Welcome back to Live on Lakeside. A smile. It is the first thing that people notice about us. And of course, we want it to be perfect while looking as natural as possible. That's so important.
That's right. And here now to tell us how we can get that amazing smile are the facial aesthetic designers here, Dr. John Heimke, along with Pinhas Adar, Master Dental Technician. Thank you both for sitting down with us today.
Pleasure, pleasure.
So can you tell us about dental implants and your dental implant team? I know you guys are top A category. You guys do it all and you do it right.
Well, basically, we have a team set up in my practice. We have a surgeon, we have a restorative dentist, which is myself, and then we have Pinhas as our laboratory. And what we do is we do a process called digital smile design, where I design the smile and basically share my vision of how I anticipate the smile is going to be down to the 100th of a millimeter to my surgeon, so he knows where to put the implants exactly, and then to Pinhas, so that he can make the teeth and the gums look exactly like natural teeth.
Right, and I really want to focus on that because you can always tell when someone has implants that don't look natural. It is so important that they do. So give us a little bit more insight on how people and how you guys help people cope with that fear and overcoming that fear.
Well, I mean, I think that's the biggest fear that most people have. Is like, is it going to last? Strength, and then how is it going to look?
Right.
It's like a bad plastic surgery. You know which one is a bad one, right? So teeth are no different. So what you need to look, it's a collaborative effort from a team that understands and executes the final look. If you look at our cases, and that's what patients find us, is they look at pictures, the results that we create, and they look so real, they look like veneers. And it's unheard of. Implants look like veneers, and that's the compliment we get. So you have to make sure that it's natural. And you know, everybody's got this fear voice in their head, but you shouldn't fear because we can make it happen.
And Dr. Heimke, you're located in Rocky River, correct?
Yeah.
So do you want to tell us a little bit about your Smile Studio?
Yes, yeah, it's not just a dental office, it really is a smile studio, like an artist studio. It's got leather chairs, it's got granite, it's got hardwood floors, and the purpose of that is so that, and very big rooms, treatment rooms, and not many of them. So only have 3, we really have only 900 square feet, but that allows me to spend a lot of time with the patient to design the smile. We take video so we can see the muscles of the face working. We take photographs, and then I design that smile, as I said, with the DSD, and then I'm able to communicate. A lot of times I'll even do a FaceTime with Pinhas. When he's in Atlanta, we're doing a live FaceTime with the patient, so we can dial in that smile basically to exactly what the patient wants and what I want to achieve to create function and aesthetics.
It's a full service platform is what you guys offer. And you did bring in some video and some pictures that we want to share as well. And tell me what we're looking at here.
So right now, you're looking at the hybrid, which is the implant screw retain type of bridge. It's solid zirconia with pink ceramic, so they look so natural. You can see it's three-dimensional.
That looks amazing.
Yeah, they look like, because somebody tells me, like, when they open the box, they say, oh my God, it has a heartbeat. It looks alive. You know, it's like,
does.
Yeah, so that's what we create. We love this. It's our obsession.
Just imagine what's happening here is patients coming in with declining teeth that they know they're going to lose. And what we do is we get the teeth out. The surgeon, Dr. Michael Morgan, takes out the teeth. I'm there at the surgery. He places the implants, and then we place teeth in there, often in the same day. 3 months later, when the implants heal, we replace that prosthesis with a prototype where I fine-tune it and work out all the details, and then we go to a seating. Like this morning, we had a patient before we came in, and we had a 15-minute appointment and delivered that final prosthesis just as you saw in there. And very little adjustment, if any. In fact, this morning we had none. Most often it's like that. Patient left extremely happy.
This morning.
This
You did
morning,
this morning.
Literally an hour ago.
I was like, wait a minute, what? I feel
I thought it's morning now.
all of a sudden I'm feeling really unaccomplished with my
I know.
morning.
Let's get to it.
So this is, I just realized, so this is almost, in a sense, like a one-day turnaround where you extract the teeth. Is that?
Well, basically, yes. The teeth come out, implants go in, and then a smile goes in. That's a healing smile. But it takes about 3 months or 90 days for those the implants to grab onto the jaw. And so at that point, then we make a prototype, which is an improvement over the first one. And the prototype, then we work out all the details, and then Pinhas makes some little corrections that I might make, and I say, we have to do this, we have to do that, and then we just dial it in. It's just like dialing it in, dialing it in until we get it perfect, and then we just go to finish.
It's like a work of art where, you know, you're being very strategic about it. Thank you guys.
I'd also like to point out, Pinhas, Adar, you're located in Atlanta at the Adar Lab Network, and Dr. John Heimke, of course, is in Rocky River. And let's give you more information. You can go to everyonelovesmysmile.com. Thank you guys so much. You really are all stars.
Thank you so much.
I was going to say, feel free to come on in anytime. We really appreciate it.
Awesome.